Chronic obstructive pulmonary disease, COPD, and asthma are both respiratory conditions with some similar symptoms, but different underlying causes and management strategies. COPD is characterized by increasing breathlessness, frequent coughing with or without mucus, and a feeling of tightness in the chest, whereas asthma typically presents with episodes of wheezing, chest tightness, and difficulty breathing that vary in frequency and intensity. Treatment for COPD may include bronchodilators, steroids, and pulmonary rehabilitation, while asthma is often managed with inhaled corticosteroids, bronchodilators, and avoiding known triggers. Smoking and exposure to certain gases or fumes in the workplace are major risk factors for COPD, while asthma risks can include a combination of genetic predisposition and environmental factors such as allergens. To understand these conditions more comprehensively, here's a look into the detailed aspects of each disease. Affected lung tissue, alveoli versus bronchial tubes. COPD, chronic obstructive pulmonary disease, and asthma are both chronic respiratory conditions, but they affect the lung tissue quite differently. COPD primarily impacts the alveoli, the tiny air sacs where oxygen exchange happens. In COPD, these alveoli are damaged or destroyed, leading to airflow obstruction and difficulty exhaling. In contrast, asthma mainly affects the bronchial tubes, causing inflammation and constriction that result in episodes of wheezing and breathlessness. While the symptoms might overlap, the specific lung tissue involvement fundamentally distinguishes these two conditions and influences their management and treatment approaches, emphasizing the importance of accurate diagnosis for effective therapy. Progression speed, rapidly progressive versus gradually worsening. COPD, chronic obstructive pulmonary disease, and asthma are respiratory conditions with overlapping symptoms such as wheezing and shortness of breath. However, they differ significantly in disease progression. Asthma typically presents with episodic attacks, interspersed with symptom-free periods, and its intensity can rapidly fluctuate in response to triggers like allergens or irritants. Treatment with bronchodilators and steroids can quickly alleviate these symptoms. In contrast, COPD is a gradually worsening disease characterized by a persistent reduction in airflow due to long-term respiratory tract inflammation. It usually progresses over years, primarily due to chronic exposure to damaging irritants such as cigarette smoke, and is not fully reversible even with medication, highlighting the importance of early detection and smoking cessation as preventive measures. Typical duration, acute versus chronic potential. COPD, chronic obstructive pulmonary disease, and asthma are both respiratory conditions that affect the airways and cause breathing difficulties, but they differ significantly in their typical duration and progression. Asthma is often characterized as an acute condition due to its episodic nature. Its symptoms can peak during an asthma attack but may be well controlled or even absent between episodes. In contrast, COPD is inherently chronic and progressive, generally resulting from long-term exposure to irritants such as cigarette smoke. Unlike asthma, COPD leads to persistent and gradually worsening lung function, often not reversible even with medication, thus affecting the quality of life and daily activities over time. Nature of cough, productive with potential consolidation versus productive with mucus. Chronic obstructive pulmonary disease, COPD, and asthma both present with coughs, but the character of these coughs often provides clues for their differential diagnosis. In COPD, the cough is typically productive due to chronic bronchitis, a hallmark of the disease, and can lead to consolidation where the air spaces in lungs fill with fluid, detectable on a chest X-ray. Asthmatic coughs, on the other hand, are often productive due to the expulsion of thick mucus, a result of the inflammatory response of the airways. While both coughs produce mucus, the nature and accompanying features of the cough, its chronicity, triggers, and radiologic findings, help healthcare providers differentiate between these two respiratory conditions and tailor treatment accordingly. Primary infection type, bacterial, viral, or fungal versus often viral or irritant-induced. Chronic obstructive pulmonary disease, COPD, and asthma are often confused due to their similar symptoms, such as shortness of breath and wheezing. However, their primary infection types differ, which is crucial for accurate diagnosis and treatment. COPD exacerbations can be triggered by bacterial, viral, or sometimes fungal infections, warranting a closer look at sputum cultures to guide antibiotic therapy. Asthma, on the other hand, is frequently exacerbated by viral infections like the common cold or by irritants including pollen, pollution, or smoke. Unlike COPD, asthma inflammation tends to be allergic and involves a different immune response, leading clinicians to utilize corticosteroids and bronchodilators for management, whereas antibiotics might be more central in treating COPD exacerbations prompted by bacterial infections. Understanding the underlying trigger is vital since it influences both acute management and long term control strategies for these chronic respiratory conditions.